This medication is administered by injection into the affected eyes by a healthcare professional. The affected eye is numbed before each injection, and after the injection, you will remain in the doctor's office for a while, and your eyes and vision will be monitored. It is given as directed by your doctor, usually once monthly for up to 12 months. Using this medication regularly will help you get the most benefit from it. To help you remember, mark the days on a calendar when you need to receive this medication. It's important to inform your doctor if your condition gets worse. If you experience eye irritation or swelling, it's important to let your doctor or pharmacist know right away. It's also important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential risks of side effects. While many people using this medication do not experience serious side effects, it's important to notify your doctor if you notice any floaters or blurry shapes in front of your eyes. In rare cases, this medication may increase your risk for certain serious eye conditions such as endophthalmitis or retinal detachment. If you experience symptoms such as pain, redness, sensitivity to light, or changes in vision, it's important to seek medical help right away. Although a serious allergic reaction to this drug is rare, it's important to seek medical help if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed here, it's important to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects or report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects or report side effects to Health Canada at 1-866-234-2345. Before starting izervay, make sure to inform your doctor if you have any allergies or if you have a current eye infection or swelling. This medication may cause blurred vision, so it's important to avoid activities that require clear vision until you can see clearly. If you are planning to have surgery, let your doctor or dentist know about all the medications you are taking. If you are pregnant, use this medication only if necessary and discuss the risks and benefits with your doctor. It's not known if this drug passes into breast milk, so consult your doctor before breastfeeding. Always follow your doctor's recommendations for the best results. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If this medication is accidentally ingested, it can be harmful. In the event of an overdose with serious symptoms like fainting or difficulty breathing, it is important to seek immediate medical attention by calling 911 or contacting a poison control center. In the US, residents can reach their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important to have regular medical checkups, including eye exams, while using izervay 2 mg per 0.1 ml intravitreal solution ophthalmic for macular degeneration. Make sure to keep all your medical appointments and consult your doctor for more information. This medication can help improve vision and slow down the progression of macular degeneration. The usual dosage is 1 injection into the affected eye once every month. It's best to take this medication at the same time each month to keep the level of the drug consistent in your body. Be sure to take each dose of izervay 2 mg per 0.1 ml intravitreal solution ophthalmic as prescribed by your doctor. If you happen to miss a dose, consult your doctor or pharmacist for guidance on when to take the next dose. This medication is not taken at home, but is instead administered in a hospital, clinic, or doctor's office. It is used to treat certain eye conditions such as macular degeneration, and the dosage and timing of administration will be determined by your healthcare provider. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.